Hello, welcome. My name is Christian Romero. I'm going to be your provider for today. So before we begin, I'm going to be recording this assessment and I'm going to be uploading it to YouTube for academic purposes. Do you agree to be or consent to be part of the video?
I consent for this video to be used for academic purposes and be uploaded on YouTube.
All right. So can you please tell me your full name and date of birth?
Tanya Romero, 11/15/82.
All right. So for today, we're going to be doing a respiratory assessment and a thorax assessment. And at this point, the patient is having a clear communication with no apparent shortness of breath. She's not tripoding, not using, she's not tachypnic or using accessory muscles. Her lips the skin is pink. There's no cyanosis. I'm gonna check her fingers for any clubbing, any cyanosis, the warmth of the skin. There's good perfusion, meaning the lungs are actually working properly. She's not respiratory rate within normal limits from 14 to 20. The AP diameter of this patient, anterior and posterior, the ratio is about 0.7 to 0.9, which is within normal limits. It's expected that from age, your ratio is going to be increased, or if, for example, if you've been diagnosed with COPD, which is a lung disease, your ratio is going to be higher. You would have like what we call the barrel chest. In this case, you're negative for that. So I'm going to be starting with palpation. I'm going to be doing the tactile fremetis. So I'm going to be comparing both sides. I'm going to have you say 99.
99.
Again.
99. 99. 99. 99. 99. 99.
So I'm going to be examining the same on the back. If I can ask you if you can turn your back towards me and the camera. So I'm feeling the vibration on both sides, which is equal, and that's within normal. Again.
99. 99. 99. 99. 99. 99. 99.
So the same thing. Now if you can face towards me, please. I'm going to be examining for costochondral tenderness, which is pretty much any pain around this area. Any pain? Yeah. Now I'm going to have my patient do a respiratory or lung excursion. So I'm going to be measuring whenever she takes a deep breath for symmetry. If it's asymmetrical, there might be an issue on one of the lungs not expanding properly. So can you take a deep breath, please? Again. One more time. Now facing your back towards me, please. So I'm going to do the same thing on the back. Take a deep breath. So if I don't know if you can actually see it from the camera. Take a deep breath again. So now I'm going to be checking I'm going to do percussion from ladder fashion. So pretty much starting over here, down, over here, down, on the other side. So comparing both sides, I'm going to be using my middle finger of the non-dominant hand. Starting up, first in the prostate. So also checking the lateral aspects of the patient and the lungs. So now I'm hearing resonance, which is normal. If I'm on top of any organs, it will be dual. Or if there's any signs or any consolidations like pneumonia, you would also hear the dual sound. Now I'm going to check your back if you can face the other way. So I'm gonna do the same process, starting up. So I'm gonna raise your sports bra just a little bit. So now I'm gonna use my pen measurement. So in this process, I'm gonna have you take a deep breath, okay? And exhale, and keep your breath in. So, and keep it like that until I tell you, okay? So ready? So go ahead and take a deep breath and exhale. So this is the area. So I was hearing from dual to resonance. You can breathe normally. Now I'm gonna mark it. All right. So now we're gonna do the opposite. So you're gonna take a deep breath and keep your air in. Okay. So. Okay. All right. Go ahead. So I'm gonna be marking the other side. You can breathe normally. So I'm gonna do a measurement from where the lung, difference between the dual and the resonance. And I'm gonna be measuring with my measuring tape. So the patient is about 3.8. So 3 to 5 is normal. So she's in the normal side. And I will do the same thing on the opposite side. It is used for time management. I'm just gonna do it on this side. And since she's already facing this way, I'm gonna be doing auscultation. So the same thing, ladder fashion. I'm gonna be using the diaphragm of my stethoscope, going over here, comparing to the sides. I'm gonna have her breathe normally. So whenever the stethoscope touches your skin, go ahead and take a deep breath. Okay. And she has clear lung sounds. There's no wheezing, no bronchi, no crackles, any abnormal lung sounds. Her breathing is within normal limits. So due to organization, I'm gonna do what we call the whisper test. So I'm gonna have you just whisper E every time my stethoscope touches your skin, okay? Just make sure that you whisper, okay? So I couldn't hear any E sound or any sound, which is normal. If I would have heard E or another sound when I was doing this, the patient might have consolidation or might be like pneumonia or respiratory or lung problem that she may have. So now I'm gonna do the auscultation on the frontal side. So if you can face me, please. So go ahead and take a deep breath. Exhale. Okay. So the same thing, the patient has clear lung sounds, no rhonchi, no crackles, and no wheezing, so no respiratory disease or anything going on. Like I said, she's having good respiratory effort, no respiratory distress noted. Let's go over here. Any questions for me?
So everything sounds good?
Yeah, as of right now, everything sounds good. So there's no lung disease or anything that I can visualize. So this is gonna conclude our video. Thank you very much.